Good morning, everybody. Welcome on behalf of Erasmus Medical Centre, and a special welcome on behalf of the cleaning team and the procurement team. We're delighted that we can now really showcase the robotic bed washing facility. Enjoy the day. Jonathan Erskine will introduce himself and tell you all about the structure of the day. I hope that it will be an informal day with a lot of questions and discussion.
Okay,
yeah?
Thank you very much. My name's Jonathan Erskine. I think I've met a lot of you, but not all of you. So I hope you have a chance to speak to those who haven't. I had the pleasure of meeting during the day. I'm the Executive Director of the European Health Property Network, which I will tell you about at some point during the day as well. But for the moment, I should just say that the European Health Property Network is a partner in the EcoQUIP project. And most of you, I think, know something about EcoQUIP because you've been to the Cambridge event or because you represent partner organisations. But just in case, I thought I'd give you a very quick overview, just as some orientation before I go on to say something about what we're going to do today. EcoQUIP is all about innovation procurement in the healthcare sector. And the aim of the project, which is now, Angus Gaynor, is it 3 years old? 3.5 years old, has been all about improving the efficiency, quality, and environmental sustainability of healthcare and the healthcare environment by using this thing we call innovation procurement. There's the partners involved, a number of hospitals or healthcare organisations which have strong links with hospital networks. Some government departments, some pan-European organisations like our own and like Healthcare Without Harm, and then the coordinating team of JIRA Consulting, Optimat, who you probably all know already. So that's the partner list. Thank you. EcoQUIP operates through actual innovation procurement projects that are taking place in hospitals, and we're here to see one of those today and see the outcomes of one of those. It also operates through trying to stimulate joint actions on innovation procurement. In other words, getting collaboration working between different hospital organisations within countries and between countries. It has a number of thematic groups for doing, if you like, some more theoretical work on some areas, which we hope will lead, and indeed has led into, some actual spin-off projects in ICT, in energy solutions. We're working on a thematic group on improving the patient environment and the patient experience, and also on technologies to improve the environmental impact of healthcare. We've got an associates program which those of you who were in Cambridge will have, last year will have experienced firsthand, which is about sharing and developing leaders in innovation procurement right across Europe. And then finally, the project's also been running exactly the kind of event that we're here today to take part in, which is peer learning workshops and opportunities for bilateral exchange of knowledge. In other words, for people to go and see actual projects in action in different countries. Thank you. So I'm just going to say, in the next couple of minutes, just run through the day, and then I'm going to introduce our first speaker, who will be Eva de Boer from IMS Innovations, starting at 9:15 prompt. And then we're going to go on to one of the two main parts of the day, which is the tour of this new robotic bed cleaning facility. We'll be split into two groups. We think the tour will take 20 to 30 minutes, is that right, more or less, for each one? So while one group is on the tour, the other group I think is going to remain here. And we have a couple of topics for discussion, but it's also an opportunity for all of you to do a little bit of networking, to get to know each other. We felt it might be a bit hard on you to actually put you to work too much this stage of the day, so we'll try and keep that part informal, but we have got some serious topics that we can introduce while you're in this room. And then when the first group comes back, the second group will go. The first group will have the opportunity to do the same kind of networking. Around about 11 o'clock, we will then move on to a perspective from both customer and supplier side, which will be the story of the VMARC and how that was developed. We'll stop for lunch at 12:15. It's another opportunity for us all to have some conversation. So I'd really encourage people, if you're in language groups or national groups, go and sit with other people, talk to other people, mix it up as best you can. And then after lunch, we're going to go on to hear from Joram Nauta from TNO, who was very involved in this project from the beginning, who's going to give us some, I hope, quite technical information about cost of ownership and the carbon reduction targets that were set as part of the evaluation criteria for this project. And then we'll hear about some other examples of innovation procurement from a perspective outside, or connected with, but somehow outside the healthcare sector. We'll have a break for coffee, and then we're going to finish up with what might come next, looking a little bit ahead to the future, what other projects and opportunities there may be, looking at Horizon 2020, and Angus is here. He's going to lead that session. We're going to try and finish up around 4 o'clock. Can I just ask, in terms of people's travel, is there anyone who needs to leave at a particular time before 4 o'clock? What time will you have to leave, just so we know?
After lunch.
After lunch?
After lunch.
After lunch, okay. But that's fine, as long as I know, then we can try and sort things from that. Okay, that's fine. So, that's it from me for now. I'll hand over now to Eva, who's going to tell you something about the VMARC and give us an introduction. Difficult to see from there, isn't it?
Yeah.
There we go. Eva, over to you.
Yeah, thank you. Well, welcome everybody. My name is Eva de Boer. I work for IMS Innovations, and we sell the VMARC, and we've introduced it to Erasmus MC. I'm going to tell you firstly something about the machine itself. So we're going to start at the result, and then after we've shown you what the result looks like and how it works, we'll take you back up here and then discuss about how the process went. Please feel free to ask me all kinds of questions during my presentation. I'd like the presentation to be a little bit interactive. Maybe things that I'm telling are boring you, and you have other questions. Please feel free to ask me and interrupt me if you think it's necessary. So I'll tell you something about VMARC, some quick facts. So when we go downstairs, you know what you can expect and what you will see. Yeah.
Will we be able to take pictures? Or
Yes, you're very free to take pictures and share. As long as you don't take pictures of the employees of Erasmus MC, they don't like to be on the internet. The targets of Erasmus MC at the procurement were the washing of 70,000 washing times a year. Significant reduction of CO2. That was they thought this is a good project to try and implement their goals in reducing CO2. How clean does a bed has to be? They didn't really know. There's not really a guideline in Holland that says how clean a hospital bed has to be. So they said, as a standard, it has to be as clean as it will be after manual cleaning. So it has to be as clean or cleaner. The process has to be validated, so we have to be able to reproduce it, or to have a validated process, so we can, so the hospital is able to tell if anything goes wrong, if there is an outbreak of an infection, if this cleaning of this part of the cleaning process had anything to do with that outbreak. Significant reduction of TCO, the costs, it has to be less expensive as the current solution. And the WIP guidelines, that are Dutch guidelines, they're not by law, so it's guidelines. And that says something about the way you have to clean. I won't tell anything about that because it's quite technical, but it wasn't like a a standard we had to follow. The achieved results after the procurement, they bought 2 machines, 2 VMARCs, and both produce a clean bed every 5 minutes. So 24 beds every hour. So depending on opening hours of the department, you can clean up to 90,000 beds per year. 65% reduction of CO2, 17 times cleaner, because the VMARC cleans 95 to 99% after cleaning. So there's a 99 reduction of ATP. The process is validated and controlled. We have a lot of management information which we can show what bed was washed at what time. There's a 40% reduction of TCO. And I think a very important extra success is that we are redefining the definition of washable beds. I don't know if you know anything about it, but the beds that are capable of sustaining through a machine, the current machines that wash with 80 degrees Celsius, that wash with 35 liters of water, there are not many beds that can sustain that. There are not many beds that have a lot of functions there. So if you want to wash with the machine, you're only capable of buying certain beds with a less function, and that only, I think they have, a lifespan of 5 to 7 years, maybe. And because we wash differently, we can wash more types of beds, a lot more types of beds, even ICU beds we can wash in the VMARC. Why did the hospital want automated cleaning? That is stated in the WIP guidelines. The cleaning procedure is of constant quality and can be validated and reproduced. Manually, it's never reproducible. It's more effective because you can wash with high temperatures. And the physical burden on employees is reduced because, I don't know if you've ever seen it, but they have to climb underneath the bed. The mattress weighs 15 kilos, so you have to lift the mattress off the bed, or you have to lift it to wash the underneath. It's really, really hard work. So, a little bit about VMARC. It's not, it's innovative, but the technologies used are not that innovative. The combination of all these technologies is what makes it innovative. It uses precision robots, and the precision robots are used in the automotive branch for painting cars. And using these robots, that makes the process very thorough and efficient. It cleans really close by the bed. That is what makes it economical and sustainable, because it only uses a little bit of water on low temperature, and it only needs low temperature because it cleans as close by as it does. And because it are robots, they are programmed in advance, so the process is validated because they can only do what we tell them to do.
Well, what is osmosis water?
Osmosis, I'll tell you.
Okay.
So we have a new standard of cleanliness, because 95% is what we can achieve. So that will be the new norm, we think. 10-liter water is used in an osmosis, and osmosis is filtered water. So it is reverse osmosis, if I'm technically right. So it's filtered, and then all minerals are out. So that's why it is very capable of cleaning. And the thing is, why we use osmosis water is by coincidence. We had output specifications of Erasmus MC, and that meant that we had to have a clean and dry bed within 5 minutes. But we weren't able to achieve a very dry bed within 5 minutes. So the washing wasn't a problem at all. The drying of the bed within the time span was the big issue. And we found out that using osmosis water, it dries more quickly because it has another kind of consistency, and it's easier to dry. So because of the drying, we started using osmosis water. But when we started using osmosis water, we found out that it's not necessary anymore to use any detergents because it's much more cleaner. It attracts dirt. But it's very technical and chemical. I don't know anything about it. If you want to know more, I can find it out for you, but that's kind of the basis. So osmosis water is filtered water. So we use tap water, and we have our own osmosis installation built in the VMARC, and it reduces it to 6.6 liter osmosis water. And the bed and the mattress are cleaned by only 6.6 liters. So not 35 liters, but only 6.6 liters. And that's a big difference with all other mechanical solutions because they use so much water on a high temperature with a lot of detergents. That's what makes it very expensive as well. So it makes it expensive. That's why we won the procurement because we had very low CO2 footprint because we didn't use any water, electricity or detergents. Only 65 degrees is used because you will see that the robot is that close by that the water doesn't cool in the process. So if you only use 65%, that's okay. And that means that if the bed comes out of the machine, you can immediately touch it and make the bed. With the other mechanical solutions, it's 80 degrees. So that means that they weren't able, without gloves, to touch the bed. It was too hot. And we can achieve this all because of the combination of all these new technologies. Because we can program the row belts, it's also suitable for IV poles, wheelchairs or equipment trolleys. We will be testing with pillows soon, because the pillows now, I don't think any institution washes their pillows mechanically, but we think we might be able to achieve that. It's a tailor-made program, so I know that other countries have different guidelines, and maybe, I think in Germany, but I'm not quite sure, they have to wash it 80 degrees. But we're capable, if you want a VMARC that washes on 80 degrees, we can adjust. We make a tailor program especially for your personal, which is in demand, but also for the bed, because the robot has to be programmed to use the right contours of the bed. It's safe and user-friendly. You only need one person to fill both machines. It's really easy to use, but you will see that later on. We've built in all kind of safety measurements. So if you put your hand in the machine, it immediately stops. That's also a big difference with other mechanical solutions. We have had accidents in Holland where people were washed in the machine during maintenance. We have a lot of management information about availability, breakdown, about consumption, which was really important for Erasmus because that was part of the procurement. And we are able to integrate track and trace. So I don't know, if you work at a hospital, you know that everything gets lost here. So if you have a bed and you need it for maintenance, for inspection, go and find it. You don't know where it is. And we can have a system integrated so that if the bed is at the VMARC for cleaning, which it will be 2 times a week at least on average, then you can get a signal that you have to put it aside so people can do maintenance or inspection. So the process is divided in 3 parts. The input, you put the bed in the first chamber. There it's identified by QR code. So we know what kind of bed it is. There you have the signal, this bed needs to be set apart. But also we know that it's this type of bed or wheelchair or IV pole, whatever it is. So you can check afterwards when was it washed, on what kind of temperature, but also what program do we need to start. For instance, it is possible to implement a system where we say the bed also always has a standard cleaning program, but once a year we have a special, extra long, extra high temperature or with detergent special program for a special cleaning annually. He checks the parameters of the bed. Is no one on it? Doesn't anything stick out? Are the cables inside the basket? You will see later on. But the robot gets so close by that if the parameters are not checked, the robots will hit the bed but it checks automatically, and if it's anything is wrong, it will say on the monitor where the default is, and then you can change it and put the bed in again. Then it will go into the cleaning chamber. The mattress, yes?
I have a question. Can you trace the bed after it leaves the VMARC in the ward, so in specific ward?
I know that there are systems that are available by iBeacon. You can use that kind of systems, but that doesn't have anything to do with the VMARC. But we can integrate those systems.
Not yet.
No, the Erasmus doesn't work with beacons yet. They use QR code, and they have a system for iTransport. It's called, for the transport of the bed to the ward and back. We have to test out, because I know some of those beacon systems work with RFID, I think. I don't know how that will work in the VMARC, so we have to test that, but I think we can, that wouldn't be a problem. I forgot to tell you, the check of parameters had a side effect at Erasmus MC. The bed has to be in perfect condition, but when it was washed manually, I think the personnel didn't always check if the bed was in the right condition. The VMARC doesn't accept beds that aren't in perfect condition. He rejects them. So the maintenance guy at Erasmus MC has been very, very busy lately since we are using the VMARC, because it rejects all the beds. And as well as the mattresses. Mattresses have to be completely whole. There can't be any holes in it, because then all kind of body juices, I don't know if that's the right word in English, but you can imagine what happens in a hospital. Will insert in the mattress, and you get quite dangerous situations. The mattress in the VMARC is lifted by vacuum. So if there is a leakage in the mattress, if there's any hole, it will reject it. So also we've had a lot of mattresses rejected that shouldn't have been in process at all.
You're saying that it's with a vacuum, but it vacuums all of the mattress?
Yeah, it's a vacuum. It lifts only with vacuum. So it lifts it up into the chamber, and then it is cleaned.
Okay, so it's the whole. It's not like two knobs.
No, it's almost a complete mattress. You will see it's a green template kind of thing. It's almost completely the whole mattress. Yes. Yeah.
I'm just wondering, and this may be a question for Anja, I'm not sure, but are you anticipating a change in the infection rates in the hospital as a result of using this?
I hope.
We hope so, but we can't.
Too early?
Yes.
Yeah.
Yeah.
We would like Erasmus MC to have scientific research done, because I know Nijmegen University did it with the other machine.
Yeah.
We would like if Erasmus does it here. Yeah.
I have a bit of confusion. The machine washes only the mattress or also the frame?
Also the frame, yeah,
Okay.
yeah. But the mattress is lifted and it is washed on top, because otherwise you can't clean properly underneath the mattress and on top of the bed. And the robots only wash the bed, and the mattress is washed on top of the machine in a kind of a letterbox with all nozzles spraying water.
So
under.
quite probably in a big hospital like this, you have also many different frames.
Now, well, that's yeah. We have the same bed here, but they're 23-year-old beds, so they're not longer all the same anymore. And that meant that in the testing week we had a lot of rejects, so we had to adjust the program a lot to make sure that all the beds fitted. But that's quite. But we are capable. If you have like 10 types of bed, we make a different program for every type of bed. But there are certain parameters within the program. For instance, the beds at Erasmus MC had a certain height. So we programmed at that height. But we learned in testing that there's a 5 centimeter difference between the beds. And that is a big difference for a robot. So we had to change the program so it accepts every bed within those 5 centimeter variable. So that, but if you just have different brands or different types of bed, and we know of it, then we can write a different program, and the robots on the QR code starts the program consisting with the type of bed. Yeah. The robot washes and dries, with the same nozzles on basis of a program in advance. So it's not interactive. The robot doesn't do anything different because the bed is 5 centimeters higher or lower. It just starts the program as we told it to do. Then there's the output chamber. The mattress is put back on the bed, and the bed can, if you take it out, you can immediately make it up. It's dry, it's not too hot anymore. There are a little bit of specks of water, but it dries within half an hour.
Probably last question. How many types of bed do you have in Erasmus Medical Centre or in VMARC?
In the Erasmus only washes one type of bed in the VMARC at this moment.
Okay. So how many they are in total?
1,000.
One type.
One type.
1,000 beds.
90,000.
Yeah, 1,100. Yeah. So like the children's bed we don't do, the ICU beds here we don't do, but we're developing. We're looking now at washing IV poles and wheelchairs we want to start.
How many beds in total do you have in Erasmus? Without children beds?
Without the 1,100 beds for adults, we have children's beds that are
So all
more
beds.
types.
So all beds you wash in the VMARC?
Not the beds for children.
Not children and not the ICU beds
No.
and the special delivery beds.
But maybe in future.
Maybe also the special mattresses with water inside.
No, we don't wash them yet because they're also not the property of Erasmus. They rent those mattresses. So it's included with cleaning the rent. So, but maybe in the future we have to look into it.
This was a question.
Yeah.
Those
Yeah, the special AD mattresses. Yeah. So we will leave for the demonstration now. Anja, I forgot to introduce her. Is my colleague here at Erasmus MC, and she's the head of the department that washes the beds. So if you have any questions, please ask her. We will now take 2 groups with us. I will do one demonstration and Anja will do the other. And then the other 2 groups will follow us with Jeroen and Maarten later.